Physiotherapy Board, Te Poari Taki Tinana. I'm really excited and I'll introduce her very shortly. We've got a guest with us that'll be helping me and helping you as physiotherapists discuss the review, what does it mean for us as physiotherapists, as well as our kiritaki, our patients and clients within Aotearoa. I will introduce her in a moment. I want to first of all give an outline of what we'll be discussing today and in this session. It's an overview of the standard, so we're not going to go blow by blow, we're looking at it in the bigger picture of that and what does that mean. There are 3 sections within the cultural safety and cultural competence standard, and they are 3 separate, but they're also interlinking and interwoven with each other. Again, we'll be discussing that. The 3 areas are demonstrating awareness and understanding of cultural competence and cultural safety, applying cultural safety and cultural competence in practice, and then the final section is engaging an ongoing reflection of your own culture and that inherent balance or the power imbalance. Before we carry on, it's really, really important to understand why we have the standard, because I know that's a lot of people's questions out there. The reason is that we have the standard because we must have the standard. It's secondary legislation. The reason why or what and how that looks for us as physiotherapists, we'll be going through that as well later on in the session. I know that there are many physiotherapists out there currently within Aotearoa practicing well within the requirements of this reviewed standard, but there will be many looking at this thinking, what on earth does this mean? How does it change, or do I need to change? A lot of different terminology. So let's get started. Sorry, a little background noise that's just made me go, oh my gosh, what's happening? But let's get started. So as I was saying, the why do we have this standard? As I was saying, it's secondary legislation, and Te Poari, the board, under section 118I of the HPCA Act, it makes physiotherapists required to practice in a culturally safe, culturally competent and culturally responsive manner. And that's especially when engaging with our kiritaki, our clients, our patients, our consumers, and with other health professionals, and the communities that all these people are involved with and part of. This is an interesting, well, I think it's a very interesting point, is that we are all different. We have so many different components of what makes up culture. And looking at from our perspective, which is quite new, but then also looking at it the perspective of kiritaki and what is their perspective. Another important fact is that Te Poari, the board, acknowledges Te Reti o Waitangi as a founding document of Aotearoa, New Zealand. And we as the board and as physiotherapists, we respect Māori as tangata whenua. Therefore, the standard integrates the overarching principles of Te Reti o Waitangi and the articles. Now, this is the exciting part. I'd really like to take this opportunity to not only thank our speaker, who's coming up in a moment, who I'll introduce, is to thank the working party that was involved with the review of this particular standard, and this is our member coming in today is one of those members, but also the involvement of our physiotherapists around Aotearoa, other RAs, our kiritaki also having input right from the very beginning, the discussion groups, the focus groups, the surveys that went out, the responses that came back, really, really rich. And that's what made this document what it is today, and how contemporary it is within Aotearoa, New Zealand, and what that looks like for not only us as physiotherapists, like I was saying before, but for our kiritaki. And that's, who we work with. This is the point I'd like to introduce, and I'm very, very fortunate to be able to welcome Cherie Tikau Harkis. As I was saying, she is, didn't say that, but she's a fellow physiotherapist. She was also in the working party when reviewing the cultural safety and cultural competent standard. And she's going to be part of the discussion today to help us as physiotherapists understand how we can implement and integrate if we're not doing this already. Kia ora, Cherie.
Kia ora marama, tēnā koutou. Ko te poho tamatia te mauka, ko whakarau pō te moana, ko kaitahu te iwi, ko kati ira kehu, ko kati whiki ohoku hapu, ko Shri Tekau Hakas Aho. Toko wha ahaku tamariki, inoho ana mātou ki ōtautahi, nō reira, tēnā koutou. So kia ora, hello everybody. Thank you for the opportunity to speak to this important standard today. The standard is really influential for the practices that we do as a physiotherapist. My name is Cherie. I whakapapa throughout Te Waipounamu. I'm an Otago grad. I've had lots of different experiences within MSK physiotherapy, not only across the breadth of clinical mahi, but also hands-off mahi as well. I'm currently in my final year of my PhD, where I'm exploring injury care, and I also facilitate a kaupapa Māori kaumātua ora program called Tauri Titu. Thank you for having me.
Oh, ngā mihi. Wow, what a pedigree she has. It's really, really exciting, and it was a really, really valuable to have you along, not only here today, but in the working party as well. So, yeah, ngā mihi anō. So let's carry on and think about, what is the purpose of this act? Going through what we were talking about earlier. So the purpose of the standard, rather not the act, the purpose of the standard is to ensure that physiotherapists engage in continuous learning, and part of that is the process of critical self-reflecting, being able to look at oneself and promote equitable outcomes. And also, as we know, with reflection, which we'll be talking about later on, it's being able to demonstrate those lifelong learnings. They're not static, they continually evolve. So this is why, what is the purpose of the standard? Before we carry on, there are some important, like everything's important, but there are some new, I suppose is the word I want to use, some new specific terms that are incorporated and are in the standard. We're not going to go through those in depth at the moment. I'm going to mention them, and I'm going to have that expectation that physiotherapists will look at the standard, have a really good read, maybe not once but twice, of what these definitions are and what these defined terms are and what these terms are, so that then one can relate it to the expectation that we have as physiotherapists within this particular standard. So I'm going to look down and read them so I don't miss anything that I wanted to say. The terms that I really want to highlight with this session is, what is cultural safety? What is cultural competence? What is cultural responsiveness? What does the term kiritaki mean? And also, what does the word within our standards and within our code of ethics must and should mean in context to us as physiotherapists? So like I was saying, have a good look, have a good read. It might take a wee while to get your head around some of these things, or not. You might be doing it already. A reminder of what we think of culture. Culture is not only limited to ethnicity, and there are a few points or factors that we have noted within the standard when considering what culture does mean, but it's not limited to that. So I'm going to read a few of these factors out, and start thinking a little bit broadly what culture means. Does that mean to you, and what does that mean for kiritaki, your clients, your patients, or the consumers? So again, I'm going to look down and read this. So some of the factors include of culture in that wider definition is socioeconomic status, being neurodiverse, lived experience of disability, tangata whaikaha Māori, personal, institutional, and organisational language, religion, gender identity, sexual identity, and body bias. So like I was saying, these are a few that we have included. It's not limited to these factors. Cherie, what does culture mean to you?
So to me, my culture is what makes me me. It's what makes me unique in the way that I be in the world. It also differentiates me between everybody else as well. So all of us within this webinar right now will have different cultures. And that's because we've had different experiences, we've had different upbringings, and we've engaged with different environments as well. When I think about culture, I think of those more known things like you've outlined with the ethnicity and the gender identity. Then I think about the unseen aspects of culture and the lesser known aspects of culture, such as perceptions, behaviours, values, and how all those different things come together, they intersect, they interact, and they make each of us our individual selves. I think another important component of culture is culture evolves over time, and that it's not static. The kiritaki that you saw last week will be slightly different to the kiritaki that you see the next week or whenever you see them that next time. So culture and that dynamicness of culture has a lot of ramifications for how we practice as physiotherapies, but it's such a broad and rich term and has a lot of aspects that you can't see. So we really can't make assumptions about someone's culture when a kiritaki or others walk in the door and first see us.
Kia ora, Sherry. You know, that makes me think we were having a discussion recently, yourself and I and us around here, the other professional advisors, because this is a topic, or even that definition is, it's quite dynamic. It's not a static term, and depending on where you are within your own, say as an example, your age, what you've experienced, exactly what you've said, will make you look through and be quite different. And it's how you, I suppose, are aware of that. And this is going to be part of that discussion further on, when what is one's own, what is one's own culture. So it's really lovely to hear what you were saying. That's, you know, you've captured it. That was beautiful. So I'm going to start moving us along into those three sections that I spoke of at the very beginning. And remember, if you're watching this later on, or even if you're watching this now, you can look at those three sections. Those sections are separate, but they do interweave, like I was saying before. So don't be frightened to go, oh, have I got this? It's going to take a wee while to work through, because we do change, and it is an evolving world. Our kiritaki are different, just because we have changed, and this is why we're working in quite a contemporary mobile state, and we have to be responsive to that, rather than what worked 2 years ago might not be appropriate now, you know, in terms of what's selected, how we discuss things. So it's a lot of things to think about, a lot of challenges. Please, physiotherapists, don't be frightened. Don't be frightened to have yaks with other physios or other people, because that makes it more, I don't know, it's richer in terms of how we view oneself and others. You know, it's like looking at both you and I, Cherie, a physiotherapist, said to me years ago, we talk about looking through lenses. And what is a lens made of? Many different pieces of stones or pebbles or incy-wincy things. So there's so many different pebbles or incy-wincy things in one lens. So I think for me that was a really neat thing, going, I've actually got lots of different angles, lots of different colours in one lens, and now I've got 4, you know, because I've got my eyeballs and my lenses. So it's never ending. Anyway, I ramble on. So if we look at that first point, if we're going to break it down at, you know, the overview, is the awareness of your own culture, and understanding how culture and it's how it can impact and affect kiritaki. That's the main first point. Quite heavy to start with, I think, in terms of that thinking. Quite different to what we are usually used to of different sort of measurable. So Cherie, what do you think? What's your thoughts on this?
Yeah, so when I think about culture and in practice, my mind goes back to that interwovenness and the interwovenness of what cultural safety and cultural competence and cultural responsiveness is in practice, and how that intimately intertwines in all the things that we do. I think with those two terms, cultural competence and cultural safety, the big difference for me and how that's reflected in what we do as physiotherapists is cultural competence is located in who we are as physiotherapists. It's who we are as a person, and then how our culture reflects in the way that we're practicing. On the other hand, and on the other side of the coin, is cultural safety centres on kiritaki and their whānau, whoever they might be in practice. And it's their perceptions and it's their desires, it's their expectations of what care is. So they're coming from two different angles when we meet at that interface within practice. And I think what that means is us as physiotherapists, as being culturally competent, we need to really take a deep dive within ourselves to understand who we are as people, as well as our culture as a physio, because we have quite a strong physio culture, and then how that shapes the interactions that we have within physiotherapy. For an example, for me, I think about my culture as a Wahine Māori. The values that I was brought up with really centred on connection. So for me as a physio, I will often chat, do lots of talking with physios. I spend a lot of time, not with physios, kiritaki, I'll spend a lot of time building that relationship, finding similarities, ways to build that connection outside of their health condition or their injury. And that's something that I've had to kind of build myself into over time, build my confidence as a physiotherapist, and also learning and understanding more about myself as a physiotherapist as well. So that's just an example of how you change as a physio over time, but also some of the practices, what we do as well. Another important thing is with cultural competence and cultural safety, because culture's dynamic, it's not something that you can tick box. So it's not something that I can do this amazing PAVM now, you know, I'm good, I'm confident, I can do this every other time with kiritaki. It's something that we can never, I guess, achieve as such. It's something that we've got to continue to work on. It's not something that we can come complacent in, because our world is ever changing. You know, I think about Aotearoa, the changes in the last year, let alone 5 years, thinking about the future of Aotearoa too, the changes that are going to happen in the next wee while as well. We need to keep growing as physios, and we need to keep pushing ourselves to lean into some discomfort and keep learning about ourselves and others as well. So really building those therapeutic relationships within practice to be able to understand who the other person is, whether it's themselves, whether it's their whānau, in practice and within ourselves too.
Oh, kia ora. I think many physiotherapists will find that quite challenging, because we were talking about this the other day. When we get trained to be able to move into undergraduate and then we out into the real world, some of the discussions on, you know, what culture is, we might start to think about that, and like what you were saying in terms of kiritaki. But I think it's a very difficult area to teach. And with the teaching, you know, what does that mean? Because what are the outcomes? So it's quite foreign to be able to go, you know, what do I bring into this? Because we were taught a long time ago, you don't impart anything about yourself. This isn't quite true, but you do your job, you do your skill. It's beyond a knee. It might have been the you know, a chain, an upper limb chain, but you don't bring part of who you are into that. So I think there is a lot of a reset, and it's okay to bring yourself into the clinic or into the situation that you're working in as a physiotherapist, but it's understanding how that can have an impact, because it isn't about you. It's exactly what you said. As a physiotherapist, it's not about you, it's about your kiritaki, or that interaction, not interaction, maybe it is. But how does that work to bring out the best, to get the outcomes that are desired and appropriate for our kiritaki? Because sometimes, as we know as physiotherapists, the desire of a kiritaki as an example, I might go, I want to run a marathon, but I've never run a marathon before, but that's what one of my outcome goals is. Well, I'm not going to achieve that. So it's being realistic, having those conversations and what we bring into that, and what that effect can be. Yeah. I was speaking to someone else that was on the working party, one of our kiritaki, and you know, I found that really interesting for many reasons. Is sometimes one asks a question as kiritaki, and it's a teaser to go, I wonder what that response is. So it might be, because I'm waiting for the response from the physiotherapist to then gauge how am I going to react to that and how much am I going to give. So I think that's quite an important factor when we are working as physiotherapists as part of our cultures. We're not talking about how wonderful we are and this, to me. If it's appropriate, yes, because I might be in, I don't know, the same community, I might be a competitive athlete and, you know, talking about that. But thinking to yourself, why is this question being asked? Oh, that's really interesting. Is it relative to what you're doing? Or is that being thrown out there to see how you respond? Yeah, so I think in terms of how does that affect our relationship, that's what I was trying to also to think about with that. I'd like us to move us on into the second part, or the second point. And you've mentioned it, I just threw my piece of paper away. You mentioned it before about it being interwoven already, and it's applying the cultural safety and cultural competence knowledge and communication skills into the practice that we do as physiotherapists. So you mentioned an example about that knowledge that we gain, the knowledge that we have in our careers and our training, and how do we put that into practice? We were talking about this yesterday, about those skills. It's quite an art form.
Yeah, and I think it's something that doesn't get a lot of recognition within our practice. I think cultural competence and cultural competence and cultural safety in practice is quite frightening and can be quite stress-inducing. And I think getting it right can actually put a lot of pressure. We can put a lot of pressure on ourselves to always get it right and then be really scared to get it wrong. So I think the first thing to think about is that sometimes we're going to get it wrong, and that's okay. It's what we kind of do afterwards that really matters. And I think sometimes when we're practicing with the greatest of intentions, but sometimes things can still go, awry. And so what that means is I think we really need to lean into some of those great soft skills that we have. It's not so much the things that we are doing, like our massage, our hands-on stuff. It's more about the other aspects. It's the relationships. It's how are you communicating with the kiritaki? What words are you using? What questions are you asking? Are you actively listening? Are you listening for something in particular, or are you letting them guide your interaction so that it flows where it needs to flow for them, so that you can understand them a little bit?
Yeah, we were talking about that. Sorry for cutting in. We were talking about that. That's Damon and I, one of the other professional advisors here. We were speaking about that. Well, he was telling a story, and I think I'm going to pop that in there because you mentioned massage, and I go, that's so true. When we are doing the soft tissue work on our kiritaki, of course we've got informed consent, and they, and explain why we're doing this, why it's required, and that's part of that communication. So that's that art. We don't just stop there. Through the whole session of whatever we're doing when we're applying, we keep checking in. Is that pressure all right? Is it, we might do a scale, or we're getting that feedback. So that, and we're responding to it. And I thought it was a really relatively simple example of we're constantly getting feedback from kiritaki. We're asking in a manner that is acceptable and appropriate, and then we're responding appropriately, either backing off a little bit or or going firmer or whatever the requirements are. So it is an art. I think it is truly an art of what people do call soft skills. I'm not sure what the terminology should or could be, because that's communication. And by what you were saying of listening to what that feedback is, one responds. And that's really important from the kiritaki's perspective, like you were saying. And it's in terms of if you're applying that, that second point, it does weave back up into what is my own culture and how is it going to affect. So that's one of the examples of how it can interrelate. Because if we don't check in, it might be a complete waste of time. We might actually hurt that person and they're too frightened to say something. Or from our perspective as physiotherapists, we might be trying too hard, like what you had said before, Cherie, and we keep asking, or asking the wrong questions, inadvertently causing, I don't know, not damage, but making the person feel uncomfortable, that they don't feel comfortable to say anything. So it's a real art form of, and that's you learn that as you do more and more. So yes, you are going to get some things wrong, and that's where it takes the bigger person to go, oh, sorry, wasn't intentional. It's feeling comfortable within oneself to be able to do that. Have you got any other thoughts?
Yeah, I think it's about leaning into vulnerability and discomfort as well. It's hard to ask some of those questions, and it's daunting to ask some of them as well. And so, finding that courage to just gently probe into some of those areas, because I know as physios, I know myself as a physio, there's times when you're practicing and you just feel something's off. You don't know what it is, but it doesn't feel like you're connected or it's fluid. So it's about, instead of just leaving it to the side and just being like, oh, that's a bit scary, it's leaning into your vulnerability, leaning into that discomfort and having some of those conversations, or if it's not with the kiritaki, it could be with others later on. But when you get that feedback, when you get that understanding, it helps us grow as physiotherapists as well. So yes, it's all about growing and having that openness to that growth that could happen.
It's like what you were saying earlier, is those first questions, or asking each other, what's going on here, seeking some feedback and learning those skills of how to ask a question, how to get that feedback. That could be even, talking to your fellow colleagues of going, well, how do you broach this sort of topic, or how do you get that feedback? And as you were saying, that creates that richness, and yes, you're popping yourself into a position of feeling vulnerable. We talk about this here all the time, is that physiotherapists, we're trained to know what the answer is, and this is what you do, and you might have a couple of options, but sometimes we don't know what to do. And saying we don't know what to do is, seeking that input from your kiritaki. Why would you not? Because we can think so many things in our mind, but it might be quite different to what kiritaki are wanting or what their expectation is. And it's, Damon and I talk about this quite a lot, is what I'm saying or what I'm giving is sometimes received quite differently. So it's checking in on that, and that can be really, really scary to go, oh my gosh, I got that so wrong, or yes, I've nailed it, I've got that right. So it's that first couple of sessions of asking the questions. Yes, you might get a bit of pushback. You might go, oh, far out, I feel so bad. Or other colleagues have gone, stop doing that because you sound really offensive, or what do you know? Try not to let that affect you so much, because I know that people have stopped doing certain things because they've been told off. That's a negative learning experience. So it's like now we're working on to our third point, which is, we've already discussed it. And this is, again, it's showing that interweaving of those 3 points. So the third point is engaging in ongoing reflection on own culture and the inherent power dynamics. And we've just spoken of that, just briefly, how it's interconnected. So I know you've got some beautiful thoughts on this one, Cherie. So, what would you like to share?
Yes, I think the first thing about this standard is, or this part of the standard is that there's two terms that we use. We use reflection and we use reflexivity. Reflexivity and reflection are in two different time spaces. So with reflexivity, it's being responsive in action. So it's the things that we're doing with our kiritaki, when we're with our kiritaki, when we're engaging or, treating whatever that interaction looks like with them. Reflection is more on the past, so it's something that we do after the fact, after we've had that session or so on. And reflection is something that we can do with ourselves. So we are reflecting on whatever's happened. It's, as I've talked to previously, it's reflecting with peers, whether it could be a mentorship space, it could be a supervisory space, or it could be peers within the clinic. I think something that we don't do well of is that we're not that comfortable with having other physios being in the room with us. Like I know as a younger physio I used to get really, oh no, there's another physio in with me. Oh, I've got to make sure everything's 100% and that I do it correct. But I think it's changing that culture around to being supportive with those multiple lenses that we can apply to those situations means that that particular technique or the care overall can be more meaningful to the kiritaki and to you yourself as a physiotherapist. That is, you are bringing yourself to the practice as well. I also think something that we could do a little bit better of is, I know myself when I've been working in clinics, the feedback box has been hidden in the back corner somewhere, and I don't think we give our kiritaki enough opportunities to provide feedback as well. Like, are we actively sending pānui notices out? Are we asking them during, after the next session or so on, what their reflections are or what their perspectives of treatment are, or the session, whatever. So I think it's an area that we could do a lot of, and I think it is so powerful for our own personal growth, but also understanding for the next kiritaki and for those next sessions as well.
Kia ora. I think this is a really great opportunity for our physiotherapists to think slightly differently to what has been the comfortable norm of how to seek that feedback. And using your own community to go, how did you get authentic feedback? We all love as physiotherapists hearing, oh, a really nice person, did really well, I didn't need many treatments. But to help us learn exactly what you're saying for our own growth, I think sometimes we need a little bit more than that. And it's positive feedback. I'm going to share an example of, you've heard this before, but in terms of one of my own whānau members went to a physiotherapist, not me. The treatment, the assessment great, treatment wasn't really suitable and didn't make any progress. Lovely physiotherapist, I heard. So then, as part of the discussion after the second session, my whānau member said, I'm not going to go back, I want to go to that other one that we went to that you took me to before. And I said, why is that? Explained why. Not getting the great outcomes like before. And I said, so are you going to supply some feedback? No. And I went, why is that? Because I thought, this is a great opportunity for me. Why are you not supplying that feedback? And the reason was, they're a really nice physio and I don't want to hurt their feelings. So I said, so you're going to cancel and just say you don't need any more treatment? Yes. I went, well, that's not really useful. So I was thinking in terms of, for us, when we do this is on that clinical level, because there are other ways, and we work as physiotherapists in different arenas. But at that clinical level, as sometimes surveys go out, and if there is a reason why people don't come back and it's because of that, but you're a lovely physiotherapist, asking it in a way that this is going to help with my development. So my learnings, you're not going to hurt me, but what could I gain that will help me in my approach? So turning it into like a positive. So kiritaki do not feel that they're being horrible to our physiotherapists, but it's being used as a point in time or a tool or feedback of going, you can make this physiotherapist way better. So I'm not being that nasty person. So it's a matter of, like I was said at the beginning of this last bit, is asking your community and fellow physiotherapists, what do you use to get feedback? Because it might look slightly different. And like what you were saying, put that anonymous, can't say that word, box somewhere that is, you can see it as they're going out the door, not hidden somewhere, and people don't feel that they're being watched popping in this feedback form. Something along those lines, potentially. So this point, engaging in ongoing reflection, and I loved your wasn't a definition of how you explained to me the difference between reflection, that's something that's happened, to that, I'm going to say this word wrong, reflexivity, because that's made me think of what we do during a session and how can we, improve ourselves or the communication or how we relate. So for many physiotherapists, this is going to be quite new because it isn't that tick box. How do you demonstrate this? So how would you think about being able to show, if someone asked me, how do you do your own reflection? What have you got any thoughts on that?
How to show it, or what do I do?
Both.
Yeah, I think as physios, we're quite naturally reflective. We've been taught from day dot to constantly reflect on what we're doing, and I think it's part of that whakawhanaunga, that constant checking in with when we're with kiritaki. It's always getting that feedback. How are you? How's this? What do you, how does this feel for you? Okay, too much, back off. How's this type thing? So I think there's that constant kind of responsiveness as you're working, but also looking at those bodily kind of cues as well. So not just listening looking with your eyes and your ears, but how does it feel? What's their body language telling you as well? So those are the things that I do within practice, and then always reflecting at the end of sessions, and then reflecting again at the next session. I've got a couple of friends that are really safe for me, that I also talk to quite regularly, because when we're practicing, there are tensions that arise quite a lot, and there's a lot of times where you think, oh no, like, what could have I done differently? I don't know about this. What do you do? So I think it's having those people around you that you feel safe to have those conversations with. So whether it be your peers, whether it be friends who are physios, or even family, I think family can be quite helpful to give you perspectives that aren't physios, and they come from that, we love you, it sounds great, but have you thought about this type thing? And I think it's also seeing your journey as well, where you've gone from, and looking at where you are now, and taking the time to sit down and really reflect on that, because I think we're so busy as well that we don't do that enough. We don't actually sit down and think about, oh, I was that physiotherapist then. This is the things that I find difficult, or I feel really comfortable with now. How can I challenge myself further, type of thing too. So lots of different things.
And like what you're saying, I'm going to jump in, and like what you're saying is we do a lot of reflection. We do demonstrate reflexivity. It's how to capture that, and sometimes it's in our head, and sometimes it's really worthwhile recording it. It can be used for our recertification, well, part of your requirements of recertification, reflection statements, or recordings. That's acceptable. How you chat with people, capturing that, because that's really useful with one's own learnings. I'm mindful of the time, which I didn't say at the beginning, that we're hitting that 40-minute mark, which was scheduled for today's session on cultural safety and cultural competence standard, the overview. I want to again mihi to you, Cherie. It's been wonderful working alongside you. It's been wonderful you being here today, and it's been wonderful sharing what you have been doing as a physiotherapist, sharing your learnings and also what you do. You've worked across physiotherapy, different areas, and you've made such an impact. Not only to us as physiotherapists, but also to kiritaki and the communities that you serve. So ngā mihi ki a koe.
Kia ora.
E hoa. So for those of you that are aware that are watching this today or looking at this as or listening to it as a podcast, this particular standard was reviewed and it comes into effect on the 1st of May 2026. If you go to our website, there are resources there as well to work within this, the reviewed standard and the updates and what those requirements are as physiotherapists practicing in Aotearoa. So once again, ngā mihi ki a tātou.